I don't care what your cholesterol is. When you come and see me, I don't even check it. I don't care. It's irrelevant. It's not bad to have a high cholesterol. It's not good to have a low cholesterol. The risk of having a heart attack going forward is about the same in both groups. So it is not an effective way to stratify your risk. What we need to do is do a simple x-ray like a mammogram for the heart. There's a mammogram, a safe, simple x-ray that can detect the disease in a high percentage of patients, that's cheap and easy for the patient to get. I mean, such a miracle test. Wouldn't it be nice if we had such a miracle test, Frank?
Yes. Let me ask you one thing about that. You're saying that we're talking about secondary prevention or primary prevention right now. So when you're talking about the screening exam like a mammogram, is this somebody that has no disease? You wouldn't do this on somebody who's already has known coronary disease with a bypass surgery, who's already had a heart attack. This is primary?
Exactly.
Okay.
Primary prevention screening. You take a guy who comes to your office, he says, hey, doc, a man or woman, they're 40, 50 years old. They say, look, I want to know if I have heart trouble. You send them for a mammogram for the heart. That's what I like to call it. It's really an electron beam CT scan of the heart. It's a safe, simple x-ray. Costs $195 at our place in Orange. And it's not my place, but it's a hospital-owned place. It can detect the disease greater than 99% of the time when it's there.
Okay, so tell us a little bit more about the test. So it's a CT, you said electron beam CT scanner. What are you looking for on that test? I mean, people get CT scans all the time for other things. So what are you looking for, and what is the information that you're gleaning from it that tells you with a high degree of probability they have heart disease?
Well, the test scores the degree of calcification in the arteries. Okay, so it's been called by many people a coronary artery calcium score. That's a little confusing. I don't like the term personally. I didn't develop that term. I prefer the term coronary artery disease score, but your score results from the fact that atherosclerosis, the process of coronary artery disease in your heart, it involves the deposition of calcium in the vessel. And it's easy to see this calcium by a CT scan, and you can score it using a computer algorithm. The score ranges from 0, which means none, zero risk, to 5,000.